Hi, my name is Raven and I'm going to be going over the anatomical terms of the ear. Here I have a list that I'll be following just to make sure I hit all the points. And here I have my unlabeled diagram. So here in my diagram, I've got the pinna, and that's the external part of the dog's ear that we can see. Then we move on to the external auditory canal. So in a dog's ear, this diagram isn't the best depiction, but it would actually be more of an L shape. So it would be the vertical auditory canal and the horizontal external auditory canal. Then we have the tympanic membrane, which is the membrane that separates the external auditory canal from the middle ear. Then we move on to the auditory ossicles, which are three little bones within the middle ear. So we have the malleus, we have the incus, and we have the stapes. And then here we have the eustachian tube that goes down from the middle ear. Right here we have the cochlear. Here we have the vestibular cochlear nerve. And here we have the semicircular canal. So right here, these little guys here. So I think that's all the talking points I have for that. The other thing I had to mention is the oral hematomas in a dog, or it could be a cat, are the poolings of blood in the pinna of the ear. So they're most commonly seen in dogs with big floppy ears. I often see them at work with Labradors. And so it's just a pooling of blood within the pinna of the dog's ear. My name is Raven and I'm going to point out the anatomical terms of the eye. Here is my list of terms, and here is my diagram that I'm going to be using, one that I found on the internet and one that I drew myself. To start us off, we've got the cornea, and right here, that's this outer portion right here on the front of the eye, that is the cornea. Then we have the pupil, so that is right here in between the iris. So on either side here is the iris, and then here we've got the pupil in the center. We have the ciliary body on either side, here and here, and those are the ciliary body. And then in between the lens, so this portion here is the lens, in between here, connecting the ciliary body to the lens are the suspensory ligaments. Then we have the choroid. So the choroid is sandwiched in between. So on the inner portion of the globe, we have the retina, and on the outer portion, we have the sclera, and in between, we have the choroid. Then we have the optic nerve, so that would be here at the back, and where it meets up with the retina here is called the optic disc. Then we have the tapetum. The tapetum is actually a portion of the choroid, and that's the reflective, that's what gives you the reflectivity of the eye when you shine a light in your eye, or in an animal's eye. Then we have, so this is the vitreous humor, or the vitreous body, and this portion here is the aqueous body, or the aqueous humor. Then we have the conjunctiva. So we've got the bulbar conjunctiva, and that is a membrane over the front surface of the eye. And then we have the palpebral conjunctiva, which is a membrane on the inner surface of the eyelid. Then we have the medial and lateral canthus. So if this is the inner corner of the eye, this is the medial canthus. And if this is the outer corner of the eye, this is the lateral canthus, and that's where the eyelids meet. Then we have the nictitating membrane, and that is right along inside here on the medial ventral side of the eye, and that is the third eyelid that comes up, is what we would commonly call it. Then we have the nasolacrimal duct. So here would be the lacrimal puncta, which is a small hole that is in the corner of the eye, and it would go down into the nasolacrimal duct, which would connect it to the nasal cavity.